Hi, this is Dr. Eric Westman with Adapt Your Life, and this week's Ask Adapt question is, should I increase my carbs once my goal is achieved? This is a great question. When I got into this area about 20 years ago, the assumption was that you had to eat carbohydrates every day, and it was based on research that was limited. Now we know, after 10 years of clinical and now basic science research, that actually the body works just fine without carbohydrate in the diet. And that's a shock for many of us who were trained the traditional way. So you don't have to increase your carbs, it looks like, if you reach your goal. The recent science is even suggesting that being in nutritional ketosis may be healthier, may prevent some of the chronic illnesses that many of us end up having. And then this summer, a study was published where mice put on a ketogenic diet, meaning without much carbohydrate at all, lived 15% longer than mice who were eating other diets. So if that's helpful for you to be persuaded, great. The experience of people who've done this, for me, it's been 20 years. Other people, 40, 50, some have lived this way all their life. Just have to measure everything that's known to be related to good health. And I think that's where we are in terms of the science. The science isn't going to say you can do this forever, but the new research is saying maybe you don't have to increase the carbs at all once you get to a goal. So getting to some of the questions, for my husband, he's at his goal. I'm not yet. Donna asks, what do we need to know? Well, I'm reassured that the biologic urge to drink and eat, for most people, I'm not including people who have eating disorders, will maintain your hunger, and you will eat and you won't whittle away to nothing. This is not a weight loss diet, much to the dismay of people who don't quite listen again. And I say, well, weight loss is a great consequence. It's a fat burning diet. You end up at your goal eating as much as you need in terms of the proteins and fats if you stay away from carbohydrates. Now, if you want to modulate the weight on your body, the fat weight, you now know that the major controller is the carbohydrate in the food, because it elicits that insulin response. So what about macros, and should I count them? And Sima asks, I know you're not a big believer of macros, Dr. Westman, and to count them because you don't have to, but you can. She says, I lowered my fat to 75 grams, increased my protein to about 100, and my weight loss is better. I feel fuller. I used to do the opposite, 100 grams of fat and only 78 to 80 protein. What do you think about that? Well, I calculated out just by the calorie level, since there are more calories per gram in the fat. By changing the macros this way, you actually reduced the calorie level a little bit. So that might be why the weight loss improved a little bit. But the other thing, well, we don't know the definite answer. That's going to be my position. I'm encouraged, or I think you ought to think in terms of grams per kilogram. So not absolute grams to achieve a goal. If you're going to do the macro counting, then it really has to be adjusted to your size. And we think of kilogram of lean body mass, which is not exactly easy to figure out, but in general, that would put you somewhere between 50 and 100 grams of protein, which is really the basis of the diet. Fill in with fat. And it's going to depend on your exercise, what you're asking your body to do. So that's another important sidebar. Are you trying to, do bodybuilding, do sports, achieve some goal like that, or are you just trying to be healthy? And then, as you said, Sima, for most of my patients just want to be healthy, and so I don't have them calculate a lot of these things because they don't have to. Most of my patients want it to be simple and easy. So Mary asks, great question. I don't want to get any thinner. Again, you're not going to whittle away to nothing. In fact, I'm encouraged with the new science. Eating less is better probably than eating more, just in general, in terms of immune function, preventing cancer, inflammation, all of that. I even heard a doctor do the absurd extreme of, I'm not going to eat anything because eating is inflammatory. Well, you can't not eat anything because then you won't survive. So there has to be a balance there. And Dr. Phenny, Karayani asked Dr. Phenny, talks about 50 grams of protein a day. What do you think? Again, we don't really know, and I would match it to your size. If someone's twice your size eating a certain amount of protein, you would not want to eat that much. Again, I don't think we have the best science to know exactly how much. Renee asks, I'm working out. How does that affect the protein and all? Doing strength and cardio. I'm not doing it to lose weight. I've been maintaining a 100-pound weight loss for over a year. I really enjoy exercise now. Well, again, my approach is to be more laissez-faire, or more less prescriptive about the amount. And your body will will figure it out if you stick to the healthy, meaning very low carb, keto choices. I'm really beginning to think, while humans are omnivores, you can choose the health of a carnivore or an herbivore as an omnivore, and I choose the health of being a carnivore in general because they don't get diabetes and all the chronic diseases that humans are getting now. Larry asked, what about carb cycling before you reach your goal? I don't know much about that. I'd like to learn. Ginger asked, how can a keto diet help me with psoriatic arthritis and psoriasis? Well, not a whole lot of published studies there, but certainly some anecdotes that might actually help psoriasis and psoriatic arthritis if you stay away from the carbs. If you just cut sugar out, you may have some benefit, but then the keto or low carb ketogenic diet would take the carbs down to about 20 to 30 to 40 total grams a day. You give it a try. David says, I've followed this lifestyle for a year. All the blood work looks great. Weight is great. Can I use net carbs now? And how do I factor that in? Well, my take on net carbs is that it's kind of like an over-the-counter medicine. It's a little weaker, but it can work for a lot of people. So you might try the net carbs, which really just means you get more vegetables throughout the day, the foundation vegetables. And we talked about that in the New Atkins for New You. I'm an author on that. But just beware that a lot of products are being put out there with net carb on the front of the label. And you just want to be careful about these other additives and these other kind of fake food products, because they can stimulate hunger and they can derail people. But in the end of the day, you might be able to use net carbs just fine. And some people can use that just fine at the beginning. It's kind of the difference between an over-the-counter and prescription strength medication. Hope that's helpful. I'm Dr. Eric Westman with Ask Adapt and Adapt Your Life. Thanks for watching. Send us your comments and suggestions below. And be sure to click on subscribe so that you don't miss out on a future episode.